The next step on that is, frankly, to put pressure on the insurance companies insofar as we can, because nobody likes them very much. And so it raises the obvious question, why are we leaving them involved in the healthcare thing if nobody likes them? Which is, of course, what preserving a public option means. Because what does preserving a public option really mean? It means preserving a private option. It means preserving the insurance companies in healthcare. That's what it means the exact opposite of what the statement says. So when you're told, oh, our goal is to preserve a public option in the new healthcare plan, what they're really saying is, we want to keep the insurance companies in the game in the United States. So I would say we need to keep an upbeat spirit. We need to discredit the Massachusetts plan, which is being held out by some as some sort of successful model, which it's not. We need to, insofar as you can get access to Webb and Warner, maybe there's a way to leverage them to push Senator Baucus, who's one of the main players on this in the Senate and has already announced that single payer is off the table without even any hearings. And the other minor snag in this thing is that we probably need to get the money from the military for this. PDA about a year ago started our Healthcare Not Warfare project, but one of the problems we're going to run into in this thing is the right wing is going to try to tell us there's no money for this. Well, of course there is money for this. Bush and Cheney doubled the defense budget. Well, not the defense budget. They doubled the aggressive military empire petroleum budget over the last 8 years. And so there actually is money that we could spend on making Americans really secure on the things that they really need to worry about, which is that way more of them die from not having health care every year than die in our wars and are likely to die from, I don't know, the Iranians, aren't they the scary people of the week that we're supposed to be scared of? The defense, the military budget, the DOD has a lot of money that we could redirect. It would provide more jobs, it would make Americans more secure, and the money's already projected to be spent. It should be spent on healthcare. However, I'm really clear that that's a very hard political project. So we're not just taking on the healthcare fight there, we're adding taking on the military at the same time. But that's probably the box that our opponents are going to try to put us into, because they're going to say there's not enough money. So the last thing I'd like to say here is, for all of us, this isn't really an intellectual battle. We've won that battle. The only healthcare system improvement that's been tried around the world are various public systems that work in Europe, and they work in Canada, and they work in Costa Rica, and they work in places around the world. We already did that experiment. So intellectually, we've won this argument. The argument really is it's more of a political fight. It's kind of a street fight. Unfortunately, the street is South Capitol Street, which is the side that the House is on. Or really, it's North Capitol Street, which is the side that the Senate's on, where we're really weak. And on that street, the lobbyists, the lobbyists have the biggest guns. And they have way too much clout on this. So we have a very uphill battle. But the reason I say that it's not an intellectual fight is that most Americans are already with us. Most Americans voted for change. They voted for health care reform, and they knew that they were doing it. And they want something to happen here. And I think the president wants something to happen this year too. And those are all things that are not normally there. And that's a good thing. I think we can get something good this year. The question is, can we get it as far as we want it? But we can drive this thing a lot further, because the economic crisis has taken Americans even further than they were in November, and they already voted for health care reform in November. And so we have a very good landscape in front of us. We just need to go to these Congress people and these senators one at a time, get them on paper, be methodical, and make them decide to stand with the Americans who need health insurance, health care, rather than the private companies. So thank you for coming, and thank you all for coming out on this. I appreciate the fact that you all sat here.